Welcome to the Social Emotional Learning Alliance for Massachusetts SEL Day webinar on SEL and mental health supports for COVID-19. I'm Jim Vetter. I'm the Executive Director of the Social Emotional Learning Alliance for Massachusetts. It's wonderful to have so many hundreds of people from all across Massachusetts here on the webinar today. I'd like to take just a moment as we start off just to thank our SEL4MA sponsors for enabling us to conduct activities like today's webinar. In particular, I'd like to thank Responsive Classroom. They are a staunch supporter of SEL4MA and SEL in general, supporting work in classrooms throughout Massachusetts, across the United States, and really around the world. We'd also like to give a special thank you to one of our newest SEL4MA sponsors, Edgenuity, and their Purpose Prep online SEL curriculum. We'd also like to thank Panorama, Lions Quest, William James College, Get Psych Sports, as well as Second Step, Open Circle, Aperture Education, Center for Supportive Schools, Get Real, and Think Give. We have a wonderful panel today who have a lot of practical expertise to share. But in these unprecedented times, we also know that all of us are figuring things out as we go. So if you came here today looking for all of the answers about the thing that your community should do right now around COVID-19 and the supports, sorry to say there is no one answer to that. That all of us are really in the process of figuring this out really together. So what we're going to be doing today is having a chance really to hear about what's happening in some different communities. And this is part of the work of we at the Social Emotional Learning Alliance for Massachusetts. We are the grassroots organization that is promoting effective SEL in communities all across Massachusetts. We do that by raising awareness about what social emotional learning is and about its positive impacts. We do it by advocating for a policy that supports effective SEL. And we do it by supporting effective practice of SEL, which includes kind of peer sharing, connecting people to each other, as well as connecting people to best practice resources. And that is our goal in being here together today. So I'd like to have a chance to have our panel introduce themselves. So I will call on each person, and if you would just, on our panel, if you just tell us what your name is, what your role is, and what district you're in, starting with Jen.
Hi, I'm Jenn Cutler. I am the Director of Counseling and Social Emotional Learning for the Ashland Public Schools. Good morning.
Good morning. And Jenn is also one of the leads of our SEL4MA District SEL Coordinator Job Alike group. So welcome, Jenn. And next, Marlene.
Good morning, Marlene De Jesus. I'm from Agawam Public Schools. I'm the Social Emotional Learning Director.
And welcome, Marlene. And Jill.
I am Jill Batal. I'm a school psychologist in Boston Public Schools, and I currently oversee the program evaluation for the comprehensive behavioral health model.
Welcome. And John.
Hey everybody, John Crocker, Director of School Mental Health and Behavioral Services for Methuen Public Schools and the Director of the Massachusetts School Mental Health Consortium.
Excellent. And welcome to you all. Really appreciate in the midst of our extremely busy schedules right now that you're taking the time to be with us. And you're from very different districts that located really spanning the state and different size of districts, different populations. In chatting with all of you, I was really struck by how, while there are different contexts that you're dealing with, which require some different responses, that there are really some very similar approaches that all of you are taking. So actually, what I'd like to toss about first is, and actually I'd like to invite everybody, both the panel and participants, to think about what would you say is one key challenge that your school or district is facing right now around the situation with COVID-19 and school closings. So let's go ahead and just think about that for a second. What would you say if you had to just pick one, and we'll talk about plenty in this period of time we'll have together, but just sort of what's one key challenge around social emotional learning and mental health that you're seeing? And we're seeing that Maria online talks about isolation, lessons of isolation, that maintaining special education continuity, folks are talking about how to connect, how to give access to technology, that about services that have stopped at school, at home, dealing with online learning, reaching out to students and not getting a response, lack of response. Equity with an exclamation point. And I know that a number of you have talked to me about that. Right, so how do special education, delivery of services on the grid, how do we do that? The kind of environments that students may be in. How do we get technology out to all students? How do we deal with the well-being of our own staff? That thinking about isolation, that students get connected when they come to school and they may be isolated from other students when they're at home, and maybe in a home situation where they're feeling lack of emotional support. Some of the things. And Emily talks about making sure they have food. Right? That many of us talked about this. How do you continue tier 1 supports for all students? Folks are wondering about. That students who may be not coming to school, school's closed, but they're living in shelters, that their living situation, maybe coming to school was the place where they got their breakfast and lunch every day, and we're in a safe environment. There's kind of a lack of resources. What happens with kids who are on IEPs? People are asking about. How do you deliver services if you've come home, you've got a day notice, and you don't have materials with you? That you're a teacher, you're trying to provide these tier 1 supports. How do you do that? How can we keep children connected? These kind of peer-to-peer relationships. So I'm wondering from each of you on the panel, that if you had to pick just one topic that you've been thinking about as a key challenge in your district, what were which may be some of the ones that folks have already mentioned, or maybe some other ones as well? What's one challenge that you see? And anybody can kick us off.
It's hard to pick one because I feel like we're all having the same multiple levels of concerns, and you name one, it triggers another one, and then it triggers another one, because it's so complex. And this is, wow, school serves a lot, and this at this time, we're like, without it, look what's going on, right? So I take a step back and going, we do some good work, but how do we continue to do the work differently, and trying to kind of go through the gray matter, the gray areas, and be able to support what we need to do as a school system, but more importantly for our children. So it's hard to pick one.
Yeah, for sure. And I'm wondering, Jill, with Boston being such a large school district, are there any particular challenges that you're seeing around providing social emotional learning and mental health supports for that many students, that many schools?
Definitely. Every challenge that people brought up, we're dealing with in Boston.
Jill, we seem to have lost your sound there for a second.
Oh.
There you go.
Can you hear
go
me
ahead.
now?
Yes, go ahead.
Sorry. I think all of those that came up, Boston is absolutely dealing with. Technology was one of the biggest barriers that many of our students and families faced. So one of our first activities as a district was to purchase and distribute Chromebooks so that our kids can access services while they're not in school. And another one that we're talking a lot about at the district is the fact that on a good day, when we're in school and no quote unquote crises come up, it's still hard for our kids and our families to access the mental health services that they need. And so now where schools are closed and a lot of the community resources have also closed, just how do we support that huge need in our community and really fill those gaps? And how do we maintain our connections with families and kids?
Mm-hmm. Yeah, and that, Jill, I think what you're pointing out that I've heard from all of you in conversations, that this kind of a situation really puts all of our systems to the test. That any of the systems that we were already sort of showing some cracks or that we didn't have a level of resource that we would want, that boy, now with the level of need having jumped up that way, that we can really see that even more. But, so I'm wondering for each of you that what was one of the first things that, and knowing that you've done a lot, and we're going to talk about a number of those different strategies, but knowing with everything you've done, what was one of the first things that your district did to make sure that kids and families were okay, that when the school closings started happening? So just think about that for a second. And Jen, I'm wondering that, do you have any examples? What's one of the first things?
Sure. So immediately we began meeting as a leadership team. So all our principals, my superintendent, assistant superintendent, myself, and the student services director, we meet every day at 11 and sometimes multiple times a day virtually. And the first things were really those basic needs. We wanted to make, we're a much smaller district. We have about 2,500 students, could be a little bit more now. So we really just wanted to make sure that the community knew what was available. So we wanted to make sure we're not required to provide food, but we are. And we wanted to make sure that everyone in our community knew that was available to anyone, regardless of their socioeconomic status or if they were already receiving free and reduced lunch. So we tried to get those types of things up and running right away. And then the other thing for us was keeping that relationship and connection. We wanted to make sure that, this was obviously a very sudden closure for all of us. And we felt it, and we knew that if we were feeling it at the administrative central office level, that everyone, including our staff, our teachers, our educators, our kids, our parents would be feeling it significantly as well. So we really wanted to make sure that every family was getting a personal connection. So we really tried to do that. Our teachers, every educator has been, I'm blown away. Amazing. Just reached out in so many different ways and had to just quickly learn ways of communication that a lot of people were not comfortable with or hadn't really used in depth before, had no training on. So I think that as a district, not just as a counseling department, those were really our first steps. We just wanted to make sure those things were really set up well in the beginning.
That makes a lot of sense, the way Ashland has responded. John, I'm wondering for Methuen, that what were some of the very first things that you folks put in place to support students and families?
Yeah, similar to kind of what I'm hearing from others, we reached out immediately to all our families. We made sure that there was a heavy amount of communication going out, updating people about, the ever-changing situation. I think that I saw a lot of adaptability in the first days. People learning how to navigate new platforms, people learning how to access information in different ways that they had previously not been accustomed to, so that they could reach out to families and resource them with some materials. I think communication, that was the first really big step, establishing those lines of communication and ensuring that each family knew we were here. In the past few days, there have been a lot of communications home. We've also set up a COVID-19 resource page that is open to all families and has educator resources and mental health resources and activities for kids and families. So we're trying to resource families. I'm seeing in the chat too things like bagged lunches and making sure that we distribute tech. So it sounds like we're doing those things as well. It sounds like, there's not a playbook for this, as you mentioned, Jim, but I think that people are coming to understand that there are some kind of foundational things that have to happen. And, Maslow's hierarchy, right? Food and shelter, and making sure that families feel protected and safe.
Mm-hmm. And John, thanks. As you're mentioning that we're seeing a lot of comments in the chat from folks who are saying that in your communities, that those are the kind of approaches you're taking, that people are talking about sort of springing into action first, the same way that Jenn mentioned as well, about making sure that breakfast and lunch is provided. Because, we can have all our wonderful social emotional learning program that we're offering to folks, but if students are not getting food, if school is where they come for breakfast, maybe for all their meals of the day, that making sure that that's provided right away is hugely important. And then lots of people are talking too about communications, just as all of you were, about communications out with families and students. And I've been just blown away by the ways that different folks have done that. That using all the technology platforms, the kind of the automatic calling systems, your email systems, but also there was a school I was talking with in Indiana where they did, which I know some folks have done similar things here. They divided up the list of students among all their staff. That they had it so that every staff member had 12 students, and they started contacting those families daily for updates. That starting with just, how you doing? And what do you need? And did you know about the food, the pickup bag lunch, or whatever the resource is? And then folks are talking, as you have been talking in the chat, about access to technology. And that piece too, that that equity issues are huge. As we're thinking about how we can provide supports during this period of time, and that which is such an uncertain period of time that all of you have talked about, that you're making plans right now, but you've got to make basically 9 plans, because who knows what this tomorrow is going to look like, and then use whichever one makes sense given what tomorrow is. But folks are talking about, if we're going to share information with students and families, if we're doing that online, well, do our students both have the devices that they need, and do students have stable internet access? And folks have been finding all kinds of creative ways to try to help that. Those inequity situations, again, really get highlighted during a crisis like this. And we're seeing a lot of response. But so Jill, as we're thinking about a district as large as Boston, that tell us a little bit about what is Boston doing to try to help students get devices?
Sure. So Boston has had a lot of resources come together at the city level to support those basic needs. So we've had a lot of food distribution resources, and we're using schools as sort of the hub to get those out. And the district also had plans of moving towards one-to-one technology for students. And when this crisis happened, we realized we needed to step up our plans and really start that immediately. So the district has purchased thousands of Chromebooks. They have a form available for families to sign up to say we don't have a Chromebook. And then volunteers from teachers to paras to central office staff and everyone in between are signing up to actually deliver those Chromebooks door to door to every single BPS student. And so that has been a great way an opportunity to give people to volunteer so that they can be helping and they can be doing something, and still connecting with their students and their families with 6 feet apart while they give out those Chromebooks.
Yeah, so trying to figure out how to navigate that in Boston is one challenge. That trying to figure out how to navigate those situations in Agawam has its own set of challenges. That Marlene, do you want to comment a little bit about that?
Sure. I think it's been in waves. So we did similar what Jill did, and we would have families either call or fill out a form, knowing that because people might not have had internet access, you have to still figure out how to reach those people that do need the Chromebooks. So we get messages, and then we develop kind of this is the day, pick up, distribute. But then we kind of slowed down, and then all of a sudden, what I noticed is as soon as everything went to a shutdown, the need went up again. And I think it's because parents are home and no longer can share their devices. And we're like, oh, there's a lot more that needs devices. And so we're running very low. I think we're on our very last, and I think that's a little worrisome for us. But every day there's new requests. So we're just trying to figure out how many we need, and is it one per family? Is it, how do we make this equitable, and how do we get families as well that might have they speak different languages and be able to access that technology in a way that works for them.
Mm-hmm. Yeah, of course, that makes sense too. That, you know, as we're thinking about how we're providing our resources online, that it's often been a big challenge for all of our communities to get current information about COVID-19, about school closings, about what's happening next, and get that out in one language. That we know if we're really going to serve our families, it can't be just in one language. And so I think that a lot of us are really kind of scrambling about how to make that work.
Yeah.
Yeah, I noticed that a number of people are sharing in the chat about this question about how we're making sure that our families have the kind of internet access to be able to use these online resources. And I see several folks are talking about different internet providers that are offering free internet at this point. And I'm wondering whether you've connected with that in any of your districts, any of you.
Yes, absolutely. It's part of, it's on our district website. It's under the resources. So we're trying to get the word out that they can access these services and have for free.
Yeah, Jen.
And sorry, Jim, if I may add to that, we have all the information out as well, but I did hear yesterday in my leadership meeting that currently the companies that are offering that are not considered essential. So they are not coming out to houses to actually be able to hook up that service. So I think we need to be, so that's another layer that we now have to be aware of.
Right.
So that adds a little more difficulty to that.
Well, and Jen, as you were talking about, and as I noticed a number of people talking about in the chat, these kind of communication systems that even within your own leadership teams are hugely important, because as you say, the situation just keeps changing. That, right, every day. So, okay, you know, we figured out what the free internet service is, we're getting that information out, and then it's a non-essential service, so it can't be coming out to connect. It really seems like having those kind of strong connections is really important. So I see that someone had mentioned in the chat that, you know, when all of you had talked about the importance of having communication, immediate communication, which I can't even imagine how that all happened as quickly as all of you did that, that folks are talking about families that may need support, but are not reaching out to ask for it. And so I'm wondering, sort of in your different districts, and as folks are typing in the chat to share your ideas too, that how have you been making connection with families? That how are you making sure that folks have the information they need, and that you know when there's somebody who may need some additional support, or when there may be students who are at higher risk? That how have any of you been approaching that? So take a moment to think about that. And then feel free to go ahead and share. And actually, I noticed that Margaret Hanna from William James College is here as well. And that she has shared about there's a network of care system in Massachusetts, which has just recently gone online. and that resource has gone in the chat now, which is an online resource that folks can use to be able to look in their area and see what mental health service providers are in their area. And that there are also some links there to some one-on-one counseling referral services. So that's a resource. And as folks have mentioned in the chat, that we're gathering all the information that's coming from the chat, the resources we've gotten from our panelists, and by early next week, we'll send out not only a recording of this conversation, but also a list of all those resources, or a link to a page with those resources on it. So again, I'll toss it out to you folks, that how are you going about making sure that there's a connection and that you're understanding the needs of the families right now?
I can share from Boston. We have 125 schools, and each school does things a little bit differently. But one of the main district priorities from the beginning, I think you guys mentioned this in your districts as well, was that there was this real clear ask from the district that every single school contact every single student and family within their school. And so a lot of what we've done is really doubling down on our connections and on our systems. So every family has had a contact from their classroom teacher, but then those students who were also working with maybe a school psychologist or a school social worker, or even a clinician from an outside agency who provides those services within schools. We've also been contacting those families as well. So in some cases, parents would get multiple contacts. And so recognizing that we already have so many strong connections and just figuring a way to maintain those now that we're all virtual. I see many of Boston's school psychologists, social workers, and teachers are actually here. So I just want to give them a huge shout out because they've been doing a tremendous job. I looked at the numbers this morning, and I think our little team of 80 people has made over 1,400 contacts and reached almost 900 families in basically 5 days. And we know that work days are a little bit shorter these days. So I think it's just a tremendous amount of work and time and commitment to our students and our families.
And thank you, Jill. That's pretty amazing. And we know that there are strategies like this happening in many districts across Massachusetts, that Dana types in the chat that as a kind of tracking system, they created a spreadsheet for each of the schools in their district. And for staff to be able to go through and track which families had not yet looked at their online systems or not responded to emails. So that kind of tracking, and then as a counselor, Dana is able to then make special reach out to those families. That their district is hugely focusing on connections, as I know all of you folks are. So having that kind of tracking, so that it's not just about, so that it is about, have we reached out, right? Have we used every channel we can to reach out, but also having some way to track the responses so that we know that actually we did make that connection. Because we know from our good social emotional learning work that, that relationships are about two-way connection, about both being able to share the good information and resources, but really hearing back and understanding the needs. That once we've got this kind of the basic connection in place, once we provided those thinking about, as John mentioned, kind of Maslow's hierarchy of needs, kind of basic survival first. So once we provided the lunch pickups and so on, help people get connected to those basic resources, have made those relationship connections, make sure that we're reaching out and have connected with all students and families, and have a way to make sure that we're hearing back. And then I know that many of our schools and districts have been thinking about those students who already were at a position at that point in their lives, and they had higher level mental health needs. So as we think about our multiple tiered systems of support, and thinking about how we're providing support across those tiers, and that can be challenging in the best of times in schools and districts to provide as much support as we'd like to, and that then during this time, But often we're thinking first about who are those students who are already relying on us in our schools, in our districts, and in our other community-based organizations. I know we have folks who are with us today who are also from out-of-school time organizations too, that also have been closed down, and we're providing key resources. So I'm wondering how you all have gone about, and again, invite folks to type into the chat as well, that how are you going about providing supports to students who, right even before COVID-19, were at that point experiencing kind of tier 3 mental health support needs? So again, I invite folks just to think about that. And then, yes, go ahead, John. Yep.
You know, as teachers were reaching out in their roster, we definitely dispatched all of our counselors and psychologists to reach out to any individuals who are perhaps are on a therapy program or receiving individual therapy in school, as a way to keep a connection alive and to set up appointments. In our first week, as we kind of built out our readiness for the technology piece and our readiness to really engage in what is ultimately going to be telehealth, we all and set up appointments, so primarily phone station, a lot of emailing. But as we enter next week, we will be starting in on some discussions around use of Google Hangouts to actually have sessions with students individually and in groups.
Yes, thanks, John. So talking about the kind of telehealth services, telemental health. And John, your internet connection seems like it's breaking up a little bit right now. And we know, isn't that a typical problem that we're having these days? That, you know, it seems like, you know, we're using this technology as a way to provide mental health services and other supports and just do our own team meetings. And lots of people who have the resources who have good devices and high-speed internet, everybody's on it right now. I've been in more Zoom meetings this week than I may have done in many weeks before that. So we know that we may even have a few of those glitches as we're together today. I'm wondering from other folks. I know that other districts are also using these telemental health services, and I'm wondering how are you going about putting those in place, and what are some of the challenges that you're navigating around it?
We're working with our established therapies and connections, and making sure that they've been able to make a connection to the families that they were serving. And if they're not, then the counselors are then following up with the families. My concern is that for me personally, during this time, I've been getting so many different types of phone calls that aren't recognizable. And I'm in the middle of working and being a mom and everything else. And so I'm not attending to my phone like I used to. And I was worried that they would miss the phone calls that the therapists were making to the families to start the services up. So we did a lot of follow-up and encouragement. Hey, you're going to hear from this provider. Let me tell you what teletherapy is about, so that they understood, because it's a new concept for some families. And expect this phone call, and let me know if you got connected or not.
Okay, that's smart. So you've got your community-based providers that if you're in a fortunate situation, those folks are already set up to provide telemental health services. And I know that there were some shifts, some guidance coming down from the state that approved additional providers to give telehealth services, particularly in this time. But if those folks then reach out to the families, or if the students are older, perhaps to the students themselves, that they may not pick up the phone because, you know, they're used to coming into their appointment and meeting with those providers, either in the community-based organization, or if you've done outside providers providing services within a school building, they're just used to showing up and are not used to getting calls. So it sounds like you're leveraging the existing relationships that you've got. If someone has in their phone book that their counselor's number, they may pick up that call, or teacher's number, they'll pick up that call. So working together, you're making those connections and making sure those happen. Any challenges that folks have found, or that questions that you're navigating around providing mental health services? Is that for anybody?
I will say that we're really I'm really in conversations with my school counselors and school adjustment counselors and psychologists right now about how we want to approach that. I'm sure a lot of you have probably seen the American School Counselor Association webinar that they just put out this week, which was extremely helpful. And they talk a lot about sort of continuing our roles in the school setting, making sure that we're following all the ethical considerations. There's really a lot that we need to think about. If you are already an ASCA member, you have additional insurance that covers you for providing services and this is the really thing you have to be careful about, that are within your scope of what you are already providing in the school setting. So I think that's something we have to be very careful about. I know that I've had parents reach out and ask, can our school counselor provide what our, like an outside type of therapy? And, we get that question normally during the school year. And, the answer is, no, it's a very different, type of service. And we explain that. But right now, I think people's anxiety is extremely high and they're worried that they're not going to be able to, if they already don't have telehealth, or a counselor outside of school, they won't be able to get one right now. So I think those are all things, my team is working, to really sort of iron out. I want to make sure that my mental health staff are protected and they're following the guidelines and doing the right things. And so I think that there's a lot, really a lot to consider. We're really trying to just go very carefully and be very consistent, having virtual meetings with our counselors, probably 2 or 3 times a week. And we're really just trying to be on the same page in what we're offering. And just really be very intentional and careful about that.
And Jen, could you say again, someone in the chat has asked about, could you repeat what that webinar was that you said happened this week that was really helpful?
Sure. It's, I don't remember exactly the name of it, but if you go to, so it's put out by the American School Counselor Association. I think the website is schoolcounselor.org. So if you go right there, it's free. You don't have to be a member. And you can watch the recording. And then they also put out a written version that pretty much says everything they said in the webinar. And it's extremely helpful. I think I just see someone posting the ethical guidelines. I see someone posting it now, Jennifer Brennan, in the chat. So yeah, that's the one. It's extremely helpful. I think I'll probably be watching it like 3 or 4 more times this weekend.
Yeah, and I'm wondering, other folks too, there was a question that came in the chat about licensure and folks asking, as a school counselor, am I licensed? Does my license cover me to provide telemental health services? And I know that Jill, I think you were looking at some of those questions.
Yeah, I can. One of my other roles is the president of the Massachusetts School Psychologists Association, MISTA. And so this topic has come up, and trying to navigate this through this time. I think in my mind, I like to think about telehealth in 2 buckets. So there's the normal conversations that we've all probably been having for several years about telehealth and how to use that responsibly to really complement our services. And then there's this current conversation about telehealth for how do we use it to respond to this crisis. And so I think this conversation can easily be confused by trying to have both of those conversations at once. Absolutely, it's something worthy of a long-term plan and a vision for how this fills some of those inequities that we see, whether it's about linguistic needs or access needs. But right now, it is sort of become a basic need conversation. And so how do we not prevent it because we don't yet have the longer term vision, but how do we lean into it now and use it really responsibly to meet the needs of our families? I think 2 things, Jim, that you mentioned earlier, I think about a lot in this conversation. One being systems and the systems we have in place. So in Boston, both at the district level and at school levels, having really close connections with partners and having really mutually beneficial partnerships, not just surface level partnerships, helps all of this roll out more easily. Because many of those clinicians who are now being asked to provide telehealth services from agencies need essentially the same training as our district employed staff, because this is a new skill set that we're all figuring out how to use. So to the extent that we've been able to have shared professional learning and shared training in evidence-based practices, this shift is a lot lighter because we already have those communities and those connections. And the other thing you mentioned, Jim, was just supporting our staff. And I think it's really important for us to think about how hard it is to change any person, whether you're talking about a kid or an adult. Changing behavior is hard. And to change behavior in schools when we see each other every day is hard. And so to now just drastically change all of our behaviors and all of our service delivery is really difficult. And so to the extent that we're supporting staff and being clear about our expectations and the supports we have available, that will be so critical to whether we see this actually happen or not.
Yeah, and good point, Jill, about the challenges in changing for all of us as individuals, and for us as groups of, as teams of staff and as schools, districts, community-based organizations, that changing practice, the changing habit is big. That's a significant thing for us as human beings, and that we're asking all of us to make big changes right now. So really important to think about the supports that we're providing for ourselves and for each other in making those changes. That some folks are very excited about moving a lot of things to online, and some people are really uncomfortable about it. That I know for me, just washing my hands for 20 seconds and trying not to touch my face has been enough to keep me busy, and in the midst of everything else that we're all trying to balance out as well on that. And just underscoring what you're saying, Jill, and Jen, what you mentioned as well, that I've heard some folks looking at what is already in their role to provide, and making sure that the supports they're providing kind of fit with that role, unless they've gotten some other specific clearance around it. So I was talking with one school in Worcester where they were providing some tier 2 supports, which we'll talk about a little later, but that they were saying that they were doing some of that using Zoom or Google Hangouts, and realized they're framing it that they're providing social support groups. They're not providing therapy, which is how they handle that divide anyway in the work they do day to day. But again, just being clear about sort of who is in a role in which they can ethically and according to liability guidelines can provide which services. And that's just a piece of coordination that a lot of us have to do right now. So it sounds like yes, go ahead, Jill.
Sorry, can I add one more thing? I think I've been really impressed with the state's ability to just really quickly make the decision that all of these mental health agencies can provide this service remotely and still bill for it. What remains to be seen, I think the biggest question at a district level is whether the districts will be able to bill for this. And I think in decision-making and sort of planning, like you talked about, Jim, the biggest risk is that we provide it and in the end can't bill for it. In my opinion, that's not a big risk, because if we provide it and it maintains those relationships, then it just makes the transition back to school much more seamless and effective. And so if the worst case scenario is that we do this and can't bill for it, my assumption would be that the state will find ways to reimburse this, because there is such a shortage of service deliveries available right now. And so I think for any districts that are thinking about that piece of it, I just take comfort in the fact that this will help teachers in the end, this will help parents, this will help everyone when we eventually do return back to school.
Well, and I think that, thanks, Jill. I think that goes back to some of when people are talking about ethical considerations, and that one of the key ethical considerations right now is to make sure that students and families have the supports they need. And to do that in a way that follows all the guidelines we can find and gets those supports to them as quickly as possible. And then, hearing about the number of places that are sending Chromebooks home, for example, that don't have that in their plan and sometimes don't even have it in their budget. That I was talking with a school that has Chromebooks that are used at school and that has now distributed those out to their students. And they said, we're figuring that there's a whole percentage of these that we probably won't get back. But that's a budget, sort of an emergency budget allocation that ethically we think is a priority to make. And that, we're trusting that our stakeholders will see that too, whoever's running our budget, and that will be made whole. And if not, we've done the right thing anyway. So John, do you have a comment that you wanted to add in? Oh, John, you just muted yourself. So go ahead and unmute. And Nick, can we unmute John? Okay, we will get you. So Nick, if you can work on that, unmuting John and let us know as soon as we got him unmuted, we'll come back around to you, John.
You got me?
We got you. Go ahead, please.
Okay. So I think one of the things that I think about right now is just, as we're talking about kind of how we approach this ethically and how we change our practice, there's no playbook right now. We're writing the playbook as we go. And while I want to make sure that we are thoughtfully entering into this, I also don't want to sidestep opportunities to connect with kids and to provide services to families. Right now, in my mind, the top priority needs to be supporting our kids and supporting families. And I think that means that we have to innovate. In a time like this, we have to be open to new practices. We have to be open to new ways of thinking about how we support kids. And that doesn't mean throwing out all of our practices and changing the game entirely in terms of what we do. But it does mean that there needs to be an openness. And I think for me, embracing some of the technology, embracing some of the modes of communication that maybe we haven't been using, that's a big deal right now.
Thanks, John. Yeah, and I know, Jill, you were talking about earlier about some of that as well, that this is a situation that is challenging, and yet there are a lot of opportunities here. That I know for us at SEL4MA, this is our first webinar. That we've been planning a webinar for a number of months now. And when this whole situation came around, we said, okay, if we're ever doing this, this is the time to do this. Let us do this now. And when initially we had, we were preparing this webinar room for up to 100 people. And when that filled up in a couple of days, we increased the capacity. And again, we appreciate all the sponsors for SEL4MA who allow us to have the kind of technology that can make an event like this possible. But we increased the webinar capacity room, the capacity of this webinar, and had about 300 people sign up yesterday. So, sometimes when the need is there, and that all of you were on the panel were willing to come on very short notice to be part of this webinar, that there are some opportunities here too. That we can move things forward sometimes in some really positive ways at the same time that we're all sort of stressed out and overwhelmed and trying just to get the basics in place. So that's always a kind of balance that we're trying to do.
One of the mantras I've been using to get for myself is that 2020 will be one of those years that we all learn so much about things we never intended to learn about. And so trying to frame it that way as we continue to lean into these new skills.
Nice. Yeah, so exactly. So isn't it always that kind of balance about sort of helping ourselves and each other and our families sort of see the potential positive aspects of all this at the same time that we're real and acknowledge what's really challenging about all this. including for everybody who's participating in this, you on the panel and everybody else here, we are also going through social distancing and the closing of the institutions that we usually go to every day. That we've got the same situations where I'm amazed that on the panel we haven't had some young person come running in the background and asking for what to do next or help with such and such, and that we know also on the flip side that while we may suddenly be home with a partner and children that we're usually not with every day in the same way, and taxing the internet bandwidth and each other's nerves, that we also know that some of us are living on our own and are used to coming into our community organizations, our schools. We're used to seeing lots of people most days of the week. And here we are trying to make those kind of connections on Zoom or whatever. That we're involved in this kind of response in a situation of high stress. So being able both to acknowledge the reality of, my gosh, this is a difficult time. At the same time that we're holding out, well, here are the good things that are happening. And that's always even when we're talking with someone in a more therapeutic setting, that's always a kind of balance between acknowledging the challenge of what's happening and continuing to hold out the hope of where we're moving together. So we were talking a bunch about providing those kind of higher level tier 3 supports, and we may come back to some of that as well. But I'd like to also invite folks to think about and share, and I've seen some things coming in the chat already about this, but what are folks doing to provide those kind of tier 1 social emotional learning supports? That, of course, getting the basic food and shelter and access in place, providing the kind of high level mental health supports. Of course, that was where we most of us focused first. But I invite you to think about and share, what are we doing to help to sort of support and reinforce the kind of the core social emotional learning competencies around recognizing emotions and managing emotions, about being able to take the perspectives of others, to be able to build strong relationships, and people were talking about that with communications, and to solve problems well together. So I invite you to think and share about what have you been doing to be providing supports along those levels.
All the counselors have classrooms set up, and so they've made teams so they all can work together and create. And
I'm sorry, Marlene, when you say classroom, you mean
Google Classroom.
Google Classroom.
Yes, thank you. So they are actively every day engaging them in activities, trying to have them respond back to the focused activity that they're doing or ideas. For instance, our junior high is doing things around TED Talk. So, providing a TED Talk and then having a discussion afterwards. And really just engagement is like the key piece right now in those classrooms.
Thanks. But other folks, what kind of supports, Jenn, what kind of supports has Ashlyn been providing on that kind of general tier 1?
Sure. So the first thing that we really started doing as a counseling department was putting together, I mean, I know that we've all been inundated with so many amazing resources through our email and Facebook and Twitter and Instagram. It can be very overwhelming as a parent and as a professional. So what we really wanted to do was provide families and students with sort of like a smaller list of, vetted resources and SEL activities and just family fun activities that they could do at this time that of course are really using all of those competencies together at home. So we created for each school in our district, so our preschool through our high school, basically like a contact, like a sheet. When I was talking to Jim about it yesterday, I said it was like a 1-pager, but when I printed it out this morning, I realized it was like 3 pages. But, I could make the font smaller. But,
please don't.
So at the top, we just have our for each building, the counselor's information. Then we have our local resources. So we have, you know, our emergency resources, phone number, website. We are very lucky in Ashland that we actually have a social work department for our town. So we have that information on there of our Director of Human Services, our food pantry, what we're offering. I just added on Out Metro West, who are providing online meetings for students right now. And so, you know, we're constantly, our National Suicide Prevention Hotline is on there and things like that. And then, so each document then goes into a list of parent resources. I try to keep it to like 3 or 4. And then we're going to change them as we go along and add new ones. But basically, like, so at our Warren, which is our K-2 school, you know, we use some different, you know, how to talk to young kids about the coronavirus. We used, you know, like a PBIS kids video, and then we go into the category of like online SEL activities. So lots of different things in there that kids can access online. You know, Second Step has the Mind Yeti videos in English and in Spanish right now on YouTube that you can freely access. So things like that, we wanted our kids to have activities to do. And then we did, you know, some family fun activities at the end, which I think I have like 6 in each for each level. And then our high school one looks a little bit different, where we have some, you know, career, we have our Naviance link for, you know, students to continue with their college and their career exploration, and, you know, some different scheduling resources to help them and things like that. So I think, so for us, that's really been sort of our first push out of a tier 1. We wanted something where it's on our main Ashland website, and then it's on each website for each individual school. And then we were pushing it out through Twitter and lots of things. So we just wanted something that parents and kids could go to and be like, okay, this is, you know, takes all that information and puts it down to a little bit more, less overwhelming document. So that's kind of how we have started to do that.
And that again, thanks, Jen. It seems like that's a real balance that a lot of us are kind of struggling with or navigating, is wanting to give as much rich resource to students and families at home, and yet not have folks just be overwhelmed by so much information, so many possibilities. So you were talking about doing that kind of vetting and curating, so that we're not just, and I think many of us who are involved in education right now are finding our email inboxes blowing up with lots of often wonderful resources that people are sending, plus some other stuff too. And that just being able to do a little bit of vetting, a little bit of picking and choosing, so that the social emotional learning materials that we're providing really are the highest quality we can offer. While at the same time, going through that vetting process quickly enough that we can just get materials out to the communities that need them right now. So that's always kind of balanced to hit. That I know, Jill, for Boston, that having evidence-based tier 1 social emotional learning has been one of the priorities for Boston. But
Yes.
Can you share a little bit about how you're at least exploring being able to provide those resources on a tier 1 basis now?
Sure. Yeah, we have many of our schools have identified tier 1 programming that they're using. In many cases, it's Second Step at the high school level. We also use DBT skills in schools, not to be confused with DBT therapy. And so for schools that are using these resources, we've vetted and curated some opportunities for teachers to continue to use that now from their virtual settings. I know Second Step has made a lot of teacher resources really quickly available given this remote learning, as well as parent access. So many of our schools have sent out the parent logins so that parents can be using Second Step and continuing to use that language that hopefully students are familiar with by March to talk about this new challenge that we're all navigating. I don't know if people saw, there was a Harvard Business Review article that came out a couple days ago that named this feeling that we all have as grief. And I loved it, and it resonated with so many people in my life and many spheres of my life. And it just made me think about this SEL and how important it is that we're continuing to name it as adults and model this for kids as we go through new challenges. So the schools have really leaned into their Tier 1 programs, and our service providers who provide both Tier 2 and Tier 3 supports, we've made no distinction in terms of who we're reaching out to and who we're continuing to offer these services to remotely. Because if a student was accessing a Tier 2 support, chances are their needs might be a little bit different right now. So in some cases, their needs will escalate. In other cases, they might still need essentially a Tier 2 level support. But to the extent that we can maintain that normalcy and maintain those connections, whether it's through the group that they receive services with or just with the individual provider, that single point of normalcy can help get us all through these difficult times. And so as a district, we've been setting up systems that allow all of our different types of service providers, whether it's school psychologists, school social workers, school-based staff that aren't connected to our central department, or agency staff who are not employed by the district but still working in our schools, thinking about all that different landscape and how do we have a common structure and system for everyone.
Well, and you make quite a number of good points there, strong points there, that one that I'd like to sort of highlight out. And you're talking about, even for us, for all of us as adults coordinating this and supporting and reaching out to families, that even just being able to model identifying and naming our own feelings.
It's hard, right?
Yeah.
With all of our new roommates and yeah.
Yeah. And that, the situation of uncertainty is really difficult for all of us. And to be able to say that, yesterday I was feeling really anxious. And both being able just to manage everything that we're all trying to manage, to provide supports to everybody, and feeling like sometimes we're making huge progress and sometimes feeling like we will never be able to do what we need to do. And then, going out on the beautiful afternoon yesterday and taking a walk. Jill, you were out there taking a run. That was hugely sort of supportive to me. That was at the same time, I'm walking down the streets here in Somerville and trying to make sure I'm keeping 6 feet of distance between one of my best friends and me and everybody who's coming along the sidewalk. So there's a lot going on. And just being able to do this for ourselves, be able to name our emotions and recognize our perspective and manage emotions well and healthfully, and being able to model that for others would be a wonderful thing if we could do that all at the same time that we're trying to get everything done. And when you were talking about the resources, that a number of the evidence-based SEL programs have been working to provide some resources and provide additional access to resources in ways that can be used in this kind of remote learning situation. That I saw in the chat that Open Circle, that's one of the evidence-based programs, is coming up with soon, about to send resources to folks who've been trained in Open Circle on how to do this work. That you mentioned that Second Step has been doing that as well, and clarifying some things like in copyright, that so that if you are if you have Second Step materials that you purchased, that you can now have some copyright waiver or copyright clarification, that you can share those in private online classrooms. So just all those things that people were wondering about and trying to figure how that was going to work. And then at the same time, that folks are then trying to figure out, how is this all going to work as well? If we've got those resources, that's lovely, but how do we use those resources in an online environment can be a kind of next question that folks are trying to figure out. So, if we've got this wonderful video.
Here's a great way to remember. Keep it strong in your head, yeah. After the storm of strong emotions, is the way to solve the problem, yeah. I said step, step. I just remember to step, step. Oh, child, you say the problem out loud now. Nothing solutions that may work on how. Explore consequences, what would happen if. Now pick the best solution and make your plan, yeah. You got to step, step.
So just an example. So if we've got now the rights to be able to share that, then again, as folks were talking about, you know, how do we as staff learn the technology to be able to be in something like a Zoom room here and be able to share that out and have the audio work and so on. So I know that there are a lot of folks who are involved in a lot of professional development right now around just, you know, we're getting these resources. How do we use them in an online environment, and how do we use them well? So again, just a bunch of what folks are juggling. But, so I'm wondering about, so we've talked about these getting basic needs, about connections and relationship. We've talked about providing those kind of tier 3 supports. We've talked now a little bit about how we're providing the kind of general tier 1 support. And I'm curious about in terms of tier 2, that what are folks thinking about right now in tier 2, and sort of where is that on your response plan? So open it up, and Marlene, do you want to start with that?
Sure, I think that's where we're at right now. We've figured out that tier 3, those kids made sure that they were connected to the supports that they needed to maintain mental wellness, providing that tier 1 through our classrooms, Google Classrooms with the counselors. And then tier 2 is when it's going to start to bubble up a little bit more now that, you know, we do have kids home. Like you said, people are kind of not used to being in that space all day, all the time. You know, I'm trying to be preventful and thinking about what things I might be seeing, maybe an uptick around domestic violence, uptick around anxiety, which is already there, but even higher. And so trying to reach out to other community supports so we can actually use them as part of our support plan that we typically might not be thinking about so intensely. And then working with our service providers to think about how we can provide a little bit more of a wraparound service with those tier 2 kids.
Mm-hmm. That makes a lot of sense. And John, I'm wondering, I know in Methuen and actually through the Massachusetts School Mental Health Consortium that you've been doing a lot around putting a strong multiple tiered system of support around SEL and mental health in place, that including things like universal screening and tiered levels of intervention at the times that students need those and not when they don't. So how is that looking for you in this very short period of time to try to adjust all that into this school closing situation?
Yeah, like I mentioned earlier, we're moving toward a point where we can start to provide groups using Google Hangout. I think that, you know, we want to try to replicate our group therapy program as best we can, but obviously we're going to have to adapt it for sure. You know, typically we're looking at 8 to 10 weeks. 8 to 10 students. I think it's going to look different, and I think we're going to have to adapt the topics of those groups as well. You know, we run depression groups and anxiety groups and mixed internalizing groups, and we're certainly going to need different topics as we navigate, you know, the COVID-19 pandemic. But I think right now we're mobilizing to be able to do that. I did want to mention, while I've got a second of airtime, I'm just going to throw a resource in the chat. I have to sign off to attend a leadership meeting, but this site that I just threw in the chat, I just sent that to Nick only. I'm going to send that to everyone now. Nick, you get a first preview of that. So this is a site that is a collaboration between a lot of Massachusetts districts. Jenn is one of the editors for this page, Sarah Bird as well. I'm getting in there to edit as well, and we're just trying to collect all kinds of resources to throw out to people. But check out the partners page, because we've got about 25, 30 districts that are contributing to this, and it's just a wonderful kind of culling of resources and dropping them into the right spots. So I just want to leave you with that and say thank you to everyone. Take care, okay?
Thank you so much, John. And when John was mentioning about collecting resources and sharing resources, which is hugely important, the page that John mentioned, you can also get to that from the SEL4MA COVID-19 response page. So if you go to SEL4MA.org and look under resources, that very first one is COVID-19 now, and that has a link to that amazing website that a number of districts with Jenn Cutler is one of the folks who've been leading that effort with John and Sarah Bird that have put that together in just days. It took, somehow we managed to pull a whole website with rich resources together in what, 3 days? It was crazy. It was wild. But so that's linked from the SEL4MA page, along with some of those other kind of a small selection of carefully vetted resources. So you can find lots of resources on there as well. And Jenn, talking about that page, and when folks, Jill and others have been talking about the kind of systems we have already put in place that we're now relying on now, I'm wondering if you and Marlene maybe could talk a little bit about, with the district SEL4MA district SEL coordinator job-alike group, that a little of what that is and how you've been sort of jumping into action right now around COVID-19.
Sure, I can start with that. So our SEL4MA, I always stumble over these words because it's very long, SEL coordinator, job-alike group. So last year when I started brand new in this position of SEL director for Ashland, I had a great desire to connect with other people who are starting out in this type of position because it is fairly new. So I started to just look up all the different SEL coordinators throughout the state that I could find. And then that's actually how I got in contact with Jim Vetter of SEL4MA, because there already was through SEL4MA something that had started, I believe maybe with Sarah Bird in Arlington. Is that right, Jim?
Yeah, when she was in Reading, exactly, yes.
Oh, she was in Reading, yep. This is, something that, I do welcome. I know many people on this call are probably big coordinators of SEL in their districts. We do have lots of different people in our group that are wellness directors, or a school psychologist who's in charge of SEL coordinating for the district, or an assistant principal. You don't just have to be a director of counseling SEL. And we have a Metro West group. We have a Greater Boston group, a Merrimack Valley North Shore group, and Western Mass group. So we're kind of, Metro West group has been meeting really consistently since last January. So we welcome, I know Jim will have the link to that. I think he just put it right up if you want to join us. But we have been working, it was kind of natural for us to, I think, all reach out to each other when this started, because we've been connecting and making sure that our SEL efforts are kind of consistent between districts, and we're really a great support to all of each other. So when this happened, it was kind of naturally everyone started reaching out to each other, and that's actually how the website that John put up started. Sarah Bird in Arlington had already begun work on it and said, hey, do you think that all of our groups together should be working on this, so we're not sort of all individually trying to put all this work into providing things for our districts? So that's kind of how that started, and it's really been, I mean, as Jim said, it's been an amazing collaboration. It's just, I don't even know what to say, really, because it's been really amazing. And so I know that I'm putting out, I've put out this website to staff and families because we're also, one big part of it that's really amazing is we have a calendar on there with live events. So it has, a lot of the SEL directors and counseling staff will be, especially now that we're now out to May 4th and then possibly beyond that in the future, lots of different events that parents could watch, mindfulness activities for kids, things that we're all kind of contributing to. So I think it's going to be a really good resource. I did see a question from someone.
Yeah, Jen, Dana was asking that for the SEL4MA District SEL Coordinator Job-like group, does that need to be just one representative per district, or can there be more than one representative for a particular district who joins the Job-like group?
You know what? We really don't have sort of a limit on that, to be honest. I do, typically we have, I think right now, I don't think there's more than one person per district on there, but I actually think it might be, what we do is we have a Google group and we have a Google Drive. So when you join our group, you're put into those and you see all of our minutes and all of our resources. So I don't see any reason why there couldn't be multiple people from a district joining. I think that would be fine. Great.
So I'm seeing some questions that are coming up from the chat that I would love to toss out to all of you on the panel. That actually, for a bit now, there've been a bit of conversation about confidentiality, and folks are wondering about, as we're thinking about something like Google Group, Google Classroom, the people are asking about, are the students' names have to show? Is there a way around that? People are wondering about if we're doing Google Hangouts or Zoom sessions, or doing telemental health, what are the kinds of confidentiality concerns around that? And I'm wondering if maybe let's think that through for a second. Let's kind of go up the tiers. So as we're thinking about, Marlene, when you were talking about the Google Classrooms that your counselors are providing, that if that's tier 1 support, that are there any concerns there around confidentiality or not?
I don't believe there is with tier 1 because we're not engaging in counseling types of work, right? We would be doing this in a classroom if you were a teacher. So it's the same type of confidentiality. I mean, you'd want to set kind of a tone around what this classroom is about and set the parameters around that ahead of time with students that come into the classrooms. One thing that came up that I learned through doing this was, as a school district, we have policies around Google, using Google Suite. So our Google Hangouts and our Meet classrooms, they're all protected within a privacy policy. And I was used to using Zoom just because I enjoy Zoom, but they don't have the same protections because it's not through the district. And so there's some issues where, information goes to third parties, and that's kind of against the law for kids to have to do. So just to be mindful around talking to your technology people around, do we have a private policy around privacy using what we're using with our students?
So that's interesting. So then that sounds like kind of two pieces of it, that for tier 1, in terms of what students might share in the Google Classroom, then it's not a therapeutic session. We're really talking about, whatever calming down techniques, taking 3 deep breaths, that if students respond around that there's no particular confidentiality concern around it. At the same time, coordinating with our technology people to make sure that the platform we're using is not compromising any information about students or families, or violating any rules of within our districts or organizations is another piece of it. So yeah, good to weigh that.
I was reading somebody, Jenn, that was saying, I'm worried about kids oversharing, and I think that's always going to be a concern, and they're going to overshare because they're used to oversharing even on their phones, right? So yeah, there's a bit of management around that, and what I've been doing is working with all the counselors through kind of a supervision and talking those things out around how to handle that. So yeah, it's always a concern, but it shouldn't stop us.
Mm-hmm. Yep, that makes a lot of sense. And Jill, I'm wondering about with the issues of confidentiality around telemental health, that I'm wondering, I know that this is, in some ways, this is fairly new territory, or at least is, telemental health is not brand new, for sure. But these key issues around confidentiality come somewhat with the territory there. But any thoughts about that in this situation?
Yeah, I think I go back to our some of our first conversations about connections and communication. I think we've been working with our staff to help unpack this idea of our professional responsibility to check in with parents about this option and get a parent preference on whether they want their student to participate. Also gauging students' interest. One of the things that's similar about virtual mental health and in-person is that if the student doesn't want to engage, it's going to be hard to engage them. And so being mindful of both parent preference, student preference, and also doing an initial check-in about level of need. I think to your point about tier 2, some of our kids in tier 2, we're going to see them shoot right up, and maybe a group is no longer appropriate given some of the things they're dealing with. In other cases, those tier 2 kids will really benefit from having that same tier 2 group in place. So I think having an initial check-in with the clinical judgment to say, is this group format going to be effective, or do I need to kind of pivot and check in more individually with kids? But then also being really clear with our other stakeholders about these issues. So talking to parents about the importance of confidentiality at home, if that's possible. Talking to students about, if you get uncomfortable in group and somebody walks into the room, shut your screen, right? There's no obligation to stay in the group or to share something that you're not comfortable sharing. And likewise for our teachers who might be hearing more in their virtual settings and hearing more students confiding in them, what's their role and what guidance do we give them on how to support students, but not also step into the therapeutic relationship if they're not trained or responsible to do that.
Mm-hmm. That sounds smart. And good point about, setting norms is always important, is always a key part of any relationship, of anything that we do in a classroom or a therapeutic setting. That in something like telemental health, that's really key. And good point that, if I'm a student who's using the phone or my adult at home's phone to be part of some sort of a online hangout or meeting, and somebody comes in, I can just put the phone down or switch to something else. And
reminding, I think it's worthy of reminding all of the people in this with us about the big three. If nothing changes now that we're on a computer, if a student expresses that they're going to hurt themselves or hurt someone else, we still have an obligation to do something about that. So sort of the limits on confidentiality as well, and making sure that everybody understands those.
That makes sense. So I see that there's a lot of rich conversation that's still going on in the chat, that we're wrapping up right to the end of our time here. That I will leave the webinar room open for a little while in case folks want to spend a few minutes continuing in the chat, that they're welcome to do that. And I'm wondering if folks can put in the chat, if we at SEL4MA offered something like this again, would you be interested? Do you think others in your districts might be interested? That seems like that there's been, okay, well, that was immediate, all right. Okay, so we will, we'll definitely, so keep watching your email. That will definitely be, and folks, if you registered for this webinar, you also joined the SEL4MA email list. If you don't want to be on that email list, next email you get, there's just an unsubscribe at the bottom, that you're welcome to unsubscribe. But we will also be sending out additional, we'll be sending out after this recording, a transcript of the chat. And I saw some people had a few things they put in that they want removed, we'll do that. And we'll be sending out the resource page. And as we schedule more conversations like this, we will definitely let folks know. That also, that Department of Elementary and Secondary Education has been sponsoring a social emotional learning and mental health multiple tiered systems of support academy that a number of cohort of districts is participating in, that they have arranged a webinar like this around SEL mental health COVID-19 supports that's happening on Tuesday morning from 10 to 11:30. And I'll stick that information in the chat as well, that while most of the academy activities are only open to folks who are part of the academy, the cohort of districts, that they're making this particular webinar open to everybody across the state. So that would be another opportunity. So in just the 2 minutes we have left, I would like to invite Jenn and Marlene and Jill just to think and reflect on and just share, in a couple of sentence or two, what's one thing that you're doing for your own self-care as you're helping support all of these people, staff members, students, and families? What's one thing that you're doing that keeps you in a good shape amidst all this stress? So, Jenn, would you like to start?
Yes. So I will say that this is something that I'm not very good at. So I have really been kind of working 24 hours a day since this began. And yesterday, I will say that I've kind of started to break down a little bit from that. So in the afternoon, in between one meeting and then a school committee meeting, I went outside on my deck, and I took 3 deep breaths, and I did what I tell all my students and my staff to do, and it really helped. And I just walked down the driveway, and I just said, we'll all get through this. I kind of like that mantra, like Jill, you were talking about, and and that's really kind of. I just had to do that. I'm hoping that this weekend I can take more time to just spend time with my kids, who I feel like I've been neglecting a bit, and just take some more breaths.
Right. Well, I think, Jenn, you've really summed that up for all of us. So thank you so much to Jill and Marlene and Jenn and John, to Jill Flanders, Nick Wolf, Nova Bureau, who have been tirelessly on the back end here, making sure that this all ran smoothly. And thank you to all of you who took your time out on this very busy morning with lots going on to be able to share with each other about the kinds of work that you're doing to provide strong social emotional learning and mental health supports in this time of COVID-19. That all of us, I'm Jim Vetter, Executive Director of SEL4MA. For all of us at the Social Emotional Learning Alliance for Massachusetts, we really appreciate all of the work that everyone's doing and being part of this grassroots effort to provide really good supports for all young people and the adults they become. So thank you so much for being here this morning, and we'll look forward to talking to you again soon.